is a cirrhotic liver seen in a 37 years old male. In this section, we are seeing the longitudinal section of the left lobe of the liver. We are seeing the ligamentum venosum as well as the segment 1 of the liver and IVC. This is the liver, left lobe of the liver, this area. In longitudinal section, this is the ligamentum venosum. This is the caudate lobe or segment 1. This is the inferior vena cava, and this area, echogenic area that you are seeing within the lumen of this IVC, forcing exterior to the caudate lobe, is the clot within the IVC in longitudinal section as well as in transverse section. Now this is the IVC, this is the clot within the IVC. Secondly, while portal vein is totally occluded by clot from its extrahepatic to intrahepatic location. See, this is the portal vein now. This area is the portal vein full of thrombus, and in left lobe of liver we do see mild intrahepatic bile-ductectasia, irregular outer surface, pores texture, and here you can see that there is an approximately 3.1 into 2.0 centimeter mass relating to the segment 1 of the liver. This is the caudate lobe of the liver or the segment 1. This is the ligamentum venosum, and IVC runs posterior to it. This is the left lobe of the liver in longitudinal section. Now this is a mass with no posterior wall acoustic enhancement. Here we are again. This does not show any evidence of posterior wall acoustic enhancement. No calcification is seen. Is hypoechoic in appearance. So the portal vein is occluded totally, and the reason for mild intrahepatic bile-ductectasia mainly seen in the right lobe is in the left lobe of the liver is a large mass in the right lobe of the liver of this young, almost 38 years, 37 years old, young. It is an infiltrative variety. It's infiltrating into almost all of the liver's right lobe of the liver. Hardly you can make up the parenchyma of the right lobe, except in the superior portion size. This is the mass. Infiltrative variety. It's difficult to measure it in one plant, and this is, however, rough measurement will be 12 by almost 12 by 12 centimeters. You can see there are multiple small rounded echogenicities seen within this mass. This is an infiltrative variety of a mass in a cirrhotic patient, age 37 years, with clot in the portal vein as well as in the IVC. Now, in this location, this fluid is the fluid between the liver and the right kidney. This is the fluid in the hepatorenal angle. And not only this, you concentrate on this area now, you will see that there is fluid in the peri-nephric space at the upper pole of the right kidney as well. This is the fluid between the renal capsule and the liver, and this fluid is below the renal capsule in the peri-nephric space. This is the renal parenchyma, a magnified view. This is the configuration, appearance of the focal mass, solid mass, infiltrative variety, that of the right lobe of the liver, with hepatic veins seen running within this mass. Again, see the configuration of this mass. This is what we will call as an infiltrative variety of solid mass, involving all of the right lobe of the liver, all its segments. And sparing the left lobe of the liver. This is the left lobe of the liver. There is no fluid seen above the diaphragm. This is the fluid between the liver and the kidney, the fluid between the hepatorenal angle. This is the fluid in the peri-nephric space. This is the fluid in the peri-nephric space. This is the renal parenchyma at the upper pole. This is the spleen. See the varices, thyroid region varices. These tiny cystic areas are all representative of collaterals. Now we are in the area of the spleen. spleen. Myers. .3 centimeters from pole to pole. 8.6 centimeter in width. Left kidney. Now this fluid is between the spleen and the left kidney. So in the spleno-renal angle, we can see fluid in the spleen, left kidney. These are varices, hilar region varices. This is the splenic vein, entering the hilum of the kidney, of the spleen. This is the splenic vein. The splenic vein does not appear to be dilated.